Coming up next on Insights on PBS Hawaii, the road to medical marijuana. Aloha and welcome to Insights on PBS Hawaii. I'm Mahealani Richardson. It's been a long and bumpy road to the fulfillment of a Hawaii law legalizing medical marijuana and providing for its distribution. The law was enacted more than 15 years ago. In fact, Hawaii was one of the first states to legalize medical marijuana. Only now is the state getting close to opening the door for dispensaries, and come July, patients are expected to have access to them. But the new system is largely untested, and no one knows for sure how this distribution will impact patients, doctors, and the medical marijuana industry. We'd like to hear from you during our show, so call us at 973-1000 if you're on Oahu, or 800-238-4847 if you're on a neighbor island. You can also watch Insights streamed live at pbshawaii.org. Just click on the title of tonight's show, or find us on Twitter at PBS Hawaii. Now on to our guests. Peggy Leong is an attorney and the administrator of the Hawaii State Department of Health's Medical Cannabis Dispensary Program. The program will monitor the quality of marijuana products from seed to sale. In July, the licensed dispensaries will be able to grow, manufacture, and study marijuana products to qualified patients. Jari Sugano is a mother of a child who uses medical marijuana to treat a rare form of epilepsy. Ms. Sugano is a member of the Hawaii Medical Marijuana Dispensary Task Force and has advocated for patients and caregivers on medical marijuana issues. Dr. Clifton Otto is an ophthalmologist with the Retina Institute of Hawaii. He specializes in the medical treatment of retinal disease and has worked closely in the implementation of various national and in-house research studies. Dr. Otto has long advocated for the therapeutic use of medical marijuana. And Carl Bergquist is the executive director of the Drug Policy Forum of Hawaii. His work is focused on ending the criminalization of drug users, improving the medical marijuana dispensary and registry programs, and combating the opioid epidemic. Thanks to all of you for coming on tonight.
Thank you very much.
Peggy, I have to start off with you. We've been waiting for the final list of 8 to come out after these applications were put in, and there's been a delay. When are we going to find out who the final 8 will be?
Well, we are projecting to have that announcement ready by next Friday, which will be the 29th. We're disappointed with the delay. It was supposed to be announced on April 15th, but we're fairly confident we're going to meet this deadline.
And why the delay?
Well, we had some issues. I mean, it's a new program, so we have some moving parts. One of them, the specific one, having to do with the fingerprinting, ability to get the fingerprinting and the background check done and processed.
How many applications? More than 70?
We had approximately 72. We do have some applicants who have applied in different counties, so it's a little bit less than that, but approximately 72.
Now tell me about your office that you're the administrator of. This is a brand new department for the state of Hawaii.
That's correct. And so the law passed in July. I just came on board in December. We are charged with having a staff of 5. We've got 4 in place right now. We have 2 surveyors. I also have a secretary. We're still searching for an accountant position to be filled. So it's been a lot to get up and running in a relatively short time.
Jari, and you've been watching this very closely. You kind of call yourself as sort of an unlikely advocate. How did you become an advocate for medical marijuana?
Well, it started back in 2013 when my daughter was 4 at the time, and she had reached the end of the road for her traditional epilepsy types of medications, and we felt that we would lose her to the condition that she has, which is epilepsy. And at that point, we realized Hawaii had a medical marijuana program, and so we found a doctor who would certify us, and we decided that we would do everything that we could to learn about this plant and figure out how to make the extractions and dose her properly and responsibly so that we could provide this as an alternative medicine for her. And it's through that process and the challenges and the triumphs that we realized that in order for the program to move forward, we needed to be more outspoken, and we needed to do more advocacy in terms of moving the state forward and helping patients like my daughter and others be able to obtain medications that many families aren't able to do. You're not able to grow your own plants and convert that plant into a medicinal form of medication. And so that's how we ended up here, drug-free education. Never intended to be sitting in this chair here today, but we're committed to doing what we have to do to push this program forward and being able to service patients and caregivers here in Hawaii.
Your attitudes have actually changed about marijuana over the years, haven't they?
You know, I believe so. I really didn't, it never crossed my mind. It wasn't something that I focused on or I was utilized in high school or anything like that. My mom was very adamant about us staying away from it. But now when I look at it and I see the medicinal value of it, my opinions and my perceptions and my behavior and everything that circles around medical marijuana has completely changed, yes.
So talk more about MJ and what life was like before she started taking medical marijuana and what life is like now.
So her life before she started medical marijuana was very, it was just circled around the hospital. Kapiolani Hospital was our main hospital. We went in and out of the ambulances. We went to work, then we'd be back in the ambulance in the hospital, and that was our routine.
Because of her seizures?
Yeah, she has a very rare form of epilepsy called Dravet syndrome, and many different types of seizures. She started out with very simple jerking or spasms. That turned into, those are myoclonic seizures. Then she started having head drops, which are atonic seizures, and absent seizures, which she would just daze off. And then the very violent types like the tonic-clonic. And today she has a few partial seizures in her sleep. But for the most part, if you see her today compared to how she was very lethargic before, her life is completely different. I mean, she's screaming in the lobby. She's very active and hyper. She wants to do things, and she knows her body is becoming stronger and she can do these things. And so cognitively, she's becoming more aware that she's a regular kid. She wants to do what regular kids do. So her life is changing, and we're trying to figure out how to make her as independent as possible and give her the support she needs to finally be a regular kid. So it's been a rough road, and she's not seizure free, but she's getting better and better every day.
Yeah, I had a really nice opportunity to meet MJ in the studio tonight. She seemed like she's really excited about seeing you on TV, that's for sure.
She's screaming.
Well, Carl, you know, you hear these stories and people's attitudes about marijuana in general have really evolved over time, haven't they?
Sure, absolutely. I think, you know, it's been the state law since the year 2000. And we have currently about 13,000 registered medical marijuana patients in Hawaii. And these are individuals that are all being helped in the way that MJ is being helped. And some of them are silent about that, some of them are outspoken, but it doesn't matter because they're all really benefiting from that being a recognized medicine by state law. And that's really important, and that's important for patients who are currently not being helped. It kind of gives them an example to maybe something they could turn to, just like Yari did when she realized there's another venue here, there's another avenue for my daughter. So that's why we're so excited about this dispensary system, because it's going to increase that even more. It's going to make certain types of medication, medical marijuana, more available. Things that, who's going to be able to produce certain types of oils or tinctures or lozenges at home? It doesn't happen. So that's what's so exciting. It's really about the patients first and foremost. So that's what's so great.
I remember when CNN's Dr. Sanjay Gupta came out and did these series of specials on television and said, you know, I was against medical marijuana and now I'm for it. And then he's showing these images of families using it, children using it, and that's very much something that you're involved with, Dr. Otto, isn't it?
Absolutely, and it was interesting to see Dr. Gupta's transition because he was relying on information that is just kind of accepted by the medical establishment, despite the fact that we are really haven't been able to do much research at all because of the Schedule I status. So,
and what does a Schedule I status mean? Because that means medical marijuana is in the same line as heroin, is that correct?
Correct, that's one of the substances, heroin, LSD. There are two different controlled substance acts that we really need to consider. One is the federal level and one is the state level. And at the federal level, in order to be in Schedule I, one of the conditions, one of the three conditions, is no currently accepted medical use in treatment in the United States. And we already know that accepted medical use exists because Hawaii exercised that authority and accepted the medical use of marijuana in 2000, something that the state decided to do without even consulting with the Department of Justice, as a lot of states do. They feel that this is something the patients need, and they institute it, hoping that there will be changes at the federal level. So there's a Schedule 1 at the federal, there's Schedule 1 at the state. At the state level, in order to be Schedule 1, you have to have the highest degree of danger. So it's in state Schedule 1 as well, even though we don't give our patients medications or drugs that have the highest degree of danger. So there are a few things that we need to sort out.
Right, and you're an ophthalmologist, but you have a range of patients who come to you for medical marijuana?
Well, you know, I stayed out. I am a certifying physician, which means that I can fill out paperwork that the state has created to certify that patients meet certain criteria that the state has established. That's how you, once you are certified by a physician, that entitles you to engage in the medical use of marijuana. Then you have to go through the registration process and then wait for a card to arrive and that kind of thing. But that's an administrative process. The main function that I serve is certifying the patient so that they're legally entitled to engage in the medical use. And so I have a variety of patients come to me. I stayed out of this for a couple of years because I was very active at the legislative level, and I thought that by getting involved in this arena where we have a lot of so-called pot docs, that might take away from my legitimacy, until I started having cancer patients, seizure patients, a variety of different patients who were really in pain and in need coming to me because none of the other regular doctors were willing to fulfill that need.
It's interesting because there are questions out there in the community that if there are physicians who you can just have a quick relationship with, you know, and say that you have a bona fide relationship, but is there really a check and balance between the patient and the physician? Are they really caring for them in the long run?
Well, you know, currently there is no check and balance at the state level for that, and that's why Department of Health has come out with their rules that are detailing what that doctor-patient relationship involves. But in order to be a real doctor-patient relationship, you have to enter into that agreement with the patient to be involved directly with their medical care. And so that involves keeping medical records, that involves doing an examination, that involves regular follow-up, and helping the patient to use this substance in the safest and most effective way possible.
Peggy, talk more about the applicants as much as you can. We've seen this list in the newspaper, which was really an eye-opening list. You have celebrities, you have lawyers, Peter Carlisle, you have a former Attorney General. Talk about this list and how much interest it's created.
Well, what I can say is it's created interest, but I cannot talk too much about the applicants. The Department of Health, we have posted on our website the applicant entities and also individual applicants, and the list is there. But as far as other people who are involved with that, because we are still going through the selection process, it wouldn't be appropriate for me to comment on that at this time.
So not this Friday, but next week Friday, when the final decision comes out, will we know the people involved and who are the investors in these companies that have been created? You know,
there will be publication of certain information. Exactly what that's going to look like, I'm not at liberty to say at this point. It'd be premature.
It was interesting because I had an opportunity to talk to a couple of people who had applied for licenses under one company, and they were not talking about who their investors are. They wouldn't say who is a part of their company. They would just basically talk about the medical marijuana industry. And so there is a feeling of who are these people, and is the state thoroughly checking their backgrounds and what their intentions are?
Yeah, I understand the concern and the interest for sure, but it's really important that our emphasis is to be sure that the process is pure, that it's done correctly without outside influence. And so because of that, you know, I can say that yes, we've taken pains to do that, but to comment further about individuals, it would not be appropriate at this time.
If I could I just speak to that
Sure.
briefly? I think one of the issues that we see right now is the stigma around this medication. It's just not seen as completely legitimate. So that's one of our hopes with the dispensary system, that it will make people more willing to come forward to say that they're part of this business. And that will also hopefully lead to a rescheduling of marijuana, which then will allow for more research along the lines that Dr. Otto talked about. So by making everything come out more into the open, people will be more comfortable to talk about it as a legitimate medicine, and also to do the research that we need, that we've done with all other medications. So
because there really is no research, because there's no federal dollars going to looking into
there is some limited research in the United States, but there's a lot of research outside the United States, where in Israel and other countries that is completely legitimate. I'm sure Dr. Otto could speak to that, where there isn't a scheduling problem like we have here. So it's done in clinical trials and above board. So that's...
Jari, can you Carl was talking about the stigma. Can you talk about the stigma for you and having a child who uses medical marijuana?
Sure. We started 3 years ago, when that was just about the time when Dr. Sanjay Gupta and the specials came out on Discovery Channel, where some of the children were starting to utilize medical marijuana, and these children have the same condition as my daughter. So it was watching the children progress, and my daughter having the same condition and thinking, why am I not doing this? So the thing that was holding us back the longest was the fact that if we go this route, and Hawaii has a program, what would people think about us? Would we end up having CPS at our door? Would HPD come? And so it was more on getting over that factor of what would people think of us versus what do we have to do first to take care of our child. And so when we put that stigma behind and we went with that focus, everything just fell into place for us. I've had nobody come up to us and question what we do or ask us why we're doing what we're doing to our child, or no one's reported us, or we haven't had people at our doorstep. But I know for a fact there's a lot of mothers that we work with and other family members that have people who have cancer that want to learn how to grow and make their own medicine. But when you ask them to come forward to do an event like this, they're very standoffish because of that stigma still exists. They're afraid of their jobs, and it's just not, we're not there yet, but we're getting there. And I think with the opening of the dispensaries and everything that comes with that, the stigma is going to change.
How does your daughter take the medication, and how do you obtain it?
So we grow it. We grow it in our backyards. We live out in Mililani, and we grow cuttings, and we finally, after 2 years, we found strains that had cannabidiol, which was that CBD cannabinoid that a lot of the children were benefiting from. So it took us a long time to find different strains, because the strains here in Hawaii are very high in THC or Delta 9. So that was the challenge in growing it, and then figuring out how to convert that flower into an oil that she could utilize, because she doesn't take things orally. So having her inhale it or smoke it was out of the question. Capsules, we couldn't make our own capsules. So we started converting it into an oil where she has a tube in her stomach, a G tube, and we pump it through her stomach every day. So it's not something that she has to take orally or smoke, or there's no transdermal patches yet. So back then that was our only option.
And those patches will be allowed now. So will be for sale, hopefully, I should say, because there's a bill in the current legislature that would add transdermal patches as something that could be for sale at the dispensaries. So we're pushing for that, and I think there's support at the legislature to add that as a form of medication.
Dr. Otto, here the differences between THC and CBD, and it's kind of a yin and yang. What are the differences between those two chemicals in the cannabis plant?
Sure. Well, the most well-known is THC, of course, delta-9 tetrahydrocannabinol, which is the most well-studied. And it's the one that is the most psychoactive of the cannabinoids. So it's the one that creates the euphoria that a lot of patients are benefiting from in terms of use for depression. It also is the one that recreational users are most attracted to because of that use. Although it's hard to tell how many recreational users might be benefiting from some of those effects. But it also has other interesting properties, anti-seizure properties, as MJ is benefiting from. It also has anti-cancer properties that are just being explored. So there's a lot to this chemical that really needs to be studied. And the chemical itself, speaking of stigma, has been stigmatized extremely because of its use, its recreational use. But the other thing is, so there's a lot of emphasis now on cannabidiol, CBD, because of its anti-seizure, neuroprotective, anti-cancer, anti-inflammatory effects that have all been documented in preclinical laboratory work and in some early clinical trials in other countries. But it's not just a matter of either THC or CBD, pick one, because we're finding that a lot of patients, especially the seizure patients, have their own unique ratio that they need. And you've probably heard about all the patients that have been moving to Colorado to get use of Charlotte's Web. Well, that might work in about 30% of these kids, but there's a large segment where they're still working out the details of this ratio. So there's still a lot of work to be done in that area. Of course, there are other cannabinoids as well that we know very little about because they're in such small quantities naturally in the plant. So,
Peggy, Glenda from Waikiki wants to know about the neighbor islands. So talk about where the dispensaries will be scattered throughout the state, and will marijuana be able to be flown in an airplane?
Okay. There's going to be one dispensary on Kauai. There are 3 for Honolulu County or Oahu. There were 2 designated for the County of Maui and 2 for the Big Island. As for transport, that's still a little bit of something that's being worked on at the legislature because, again, this goes back to the Schedule I prohibition. And once you are in the air, which is considered a federal space, if you will, and at whether it be a 3-mile out or a 12-mile out on the water, you're going to be hitting federal jurisdiction. So that's still, everybody's struggling with that legislatively and policy-wise, and even as we're looking at how we're going to be doing testing and setting up of various labs, et cetera. So that's a work in progress for sure.
Brooke from Honolulu, Carl, wants to know, why can't medical marijuana be dispensed through regular pharmacies?
Well, maybe one day they will. We'll be able to do that. But for now, it's a unique, brand new thing that we're seeing in other states. And I think that it's the research, because of the stigma, because of the law, makes it unique in that sense. And I think it's a good way to sell it for now. But one day I would hope that it could be a medication that would be available anywhere in a pharmacy, and why not over the counter?
Keola from Kalihi wants to know, do people who take medical marijuana get high? Jari, what's your daughter's experience right after she takes it through her stomach?
So it just depends on how much THC is in the final product. There's side effects that I would say that there is the psychoactive component of THC. So she takes about a 2-to-1 ratio of cannabidiol with THC, which is a high ratio compared to other patients. But she also has we do like a whole plant type of oil where we get all the different cannabinoids as well. So she doesn't get that high feeling that people may think she would, but then she does get a little tired and it puts her to sleep very well. She has a lot of seizures in her sleep. Before, she used to have 15 seizures in an hour. But with the THC in there, when she sleeps very well some nights. So there's some side effects. People call it psychoactive effects of THC, but for her, it allows her to sleep peacefully with minimal seizures. So, yeah.
Dr. Otto, like other drugs, there are these side effects. And so what are the experiences of your patients? Are they getting high?
Well, the patients who are using this for medical use are not looking to get high. They just want to be healthy. And so for them, they are adjusting the dose so that it gives them the best effect. So if they are getting high, or if some patients, like elderly patients, will get very dizzy if they take too much. So then the dose needs to be adjusted, or maybe the route of administration needs to be changed so that they're getting maybe the pain relief they need without getting the dizziness. And that's something that needs to be individualized just about for every single patient, which makes it so interesting and so challenging. I just wanted to make one comment really quickly to the caller who called in about the pharmacy availability. In order to be available in a pharmacy, a drug substance has to go through the FDA clinical trial process. And that's a very lengthy, very expensive process. Once it gets approved by the FDA, which allows it to be marketed interstate, then it can be sold in pharmacies. But that requires a commercially viable pathway whereby a company can create maybe a patented preparation that can be taken through all those trials so that they can at least get some return. And that's just not possible when the substance is in Schedule 1 and you're relying on a supply through NIDA and the University of Mississippi, which does not have any commercially viable pathway, at least for the company that wants to take it to market. So that's what's keeping it from being available in a pharmacy.
What has the state done to look at the, let's say, the economic impacts of a medical marijuana industry? Peggy, do you have any?
I don't have any specifics. I can tell you, though, that there is a bill now that, it's the same bill that we were referring to earlier, that has a proposition for the Department of Business and Economic Development and Tourism to gather information. Department of Health would be one of the sources, but from the dispensaries to look at the impact of that.
Once these dispensaries are up, it's all cash, correct?
I believe so. I think that's what's going on in Colorado and Washington. You can correct me if I'm mistaken on that, but that's my understanding because, again, of the whole Schedule 1 and the
Actually,
federal.
there's some good news in that area. There was a story in the Associated Press just yesterday showing that in the last 2 years, the number of banks and credit unions that have gotten involved has quintupled. So you see that as the businesses are becoming more recognized and the stigma is disappearing, and the federal guidelines saying that we're not going to go after legitimate businesses that are dealing with medical marijuana as opposed to organized crime, that banks and credit unions are becoming more willing to do this. So in Washington, I think it's about half of the dispensaries there work through banks. They pay their taxes through the banks right now. So other states, that's not as clear yet, but that's the trend. And so we're hopeful that Hawaii will follow that as well.
We've seen that medical marijuana is the fastest growing industry in the United States, but is it necessarily a guaranteed cash cow once these dispensaries are open?
Well, I think speaking to the point you asked earlier about how Hawaii could benefit, one of the things that we had in the Dispensary Act was a reciprocity system for out-of-state patients. So Hawaii obviously survives in large measure on tourism. So starting in 2018, out-of-state patients will be able to come here and go to these dispensaries. So we're hoping that, we would advocate for that next year to actually push that up when the dispensaries open and show that they actually are helping patients. So I think, whether it's a cash cow for the investors, that's sort of a side benefit. We're really advocating for patients and also for local businesses to be involved. But we think it's certainly the future. It's a viable industry that is unexplored.
Tonight we're talking about the road to medical marijuana, so we'd like to hear from you. So please call, email, or tweet your questions and comments. Call 973-1000 or 800-238-4847 if you're calling from a neighbor island. Jesse has a really interesting question about the current growers. We don't even know how many growers there are in the state of Hawaii. And then the dispensaries, once they are here, how do they operate side by side? Dr. Otto, do you have any thoughts on that?
Well, the state protects the rights of patients to be able to grow their own medicine. And there doesn't seem to be any indication yet that that's going to be taken away, although there was a bill, I think earlier this session, that hinted that was something that some people wanted to do. But, our state constitution protects our right to privacy. And so I think it's going to be very difficult to take away a patient's right to grow their own medicine in the privacy of their own home for their own personal use, as long as they're not selling it or harming themselves with it. And it's a tough area because, of course, you're going to have the dispensaries on one side who might feel that if patients are growing for themselves, they're going to interfere with that. And on the other side, there is, well, are the dispensaries really going to be able to provide what the patients need? Because this is going to be financially driven no matter what, based on the expenses of electricity and real estate and all that kind of stuff.
And the cost of the marijuana itself.
Well, and that's what we don't know yet. How much is this going to cost when it's sitting on the shelf, is the patient going to be able to afford it? And is it even going to be in the form that the patients need?
Jare, what kind of prices are you paying out of your own pocketbook? I can't imagine it being inexpensive.
So I was just telling Jim Mendoza the other night, for our child who's 50 pounds, if we wanted to give her 100 milligrams of cannabidiol or CBD and balance that with some THC in there, for us to purchase the oil, if the oil is at the market price of $75 to $95 an ounce for the tincture, that would run us about $450 a month just to maintain her at that level, and she's 50 pounds. So at that point, it's cost prohibitive for us. So we intend to keep our ability to grow our own on the side, but we want access and we want ability to that lab tested and that sound medicine. So we know we're going to have to give up some of that. We're going to have to pay a little bit so that we can get access to that, but we're not going to be able to hit the numbers that we want in terms of dosage if the price is too high.
I think Jesse was also hinting at, there is the black market of marijuana, and it's going to be growing, if you will, side by side with these dispensaries. How do you think that's going to affect the marketplace?
Well, I think one of the things that we're going to see that's predicted is that the number of registered patients with the state will grow, will double. The legitimate industry will grow, and that will bring patients out of the woodworks and into that system. So that will hopefully provide the people in the black market an incentive to go legitimate. And then as we see that market grow, we can see more licenses awarded on the neighbor islands, for example. There was a bill this legislature to give another license to the Big Island, which obviously has the most registered patients. It has more patients registered than Oahu, despite the population difference. So we're hoping to see that happen and then get these local businesses involved. And one of those would be people that could transition. They would have to do it in a certain way, but they could transition from the black market into the dispensary industry. There's no reason, and the law would allow that. So.
Peggy, someone wants to know about impaired driving, and I know we don't have the police department here today, but I know you've been asked before, if someone takes medical marijuana and they drive, what's going to happen to them?
Well, that's something, everything is new here, and that's one of the things that we're struggling with. Again, legislatively, that came up again this year. And there's a number of challenges, so it's not answered, but the challenges be how do you measure? It's not like where you have a DUI situation where you can have a blow test. It's invasive. It's often done with could be a blood test or whatever. And then the other thing, which Dr. Otto alluded to, is just that whole how do you measure? Not only how do you measure, but what is the proper measurement? At what point are you impaired? And if I'm impaired at a certain level, is that the same for Dr. Otto or anybody else? So it's something that as we are all making our way through this new system and new program, we need to be aware of, and we're all struggling with.
Yeah. Did you ever think that you'd be working in this position, let's say 10 years ago?
Absolutely not. It's not something that I could foresee, but you can see the passion, you can see the need, and it's a priority not only for the department but for me personally. We want to be sure. We talked about the black market. Well, the other thing that isn't addressed when you're talking about black market is that patients are already in a compromised situation. Their health is already compromised. So it's, the department does not make the law, but it is our job to ensure that there is compliance with the law, and our ultimate priorities are the product safety, safety of the patient, and safety of the public as well. And it's all a balancing test.
And when the medical marijuana law passed the first time, everyone asked, wait a minute, they can use it if they have a bona fide use for it, but how do they obtain it? So, when you got those first seeds or that plant, how did you do it?
I asked around. And it came from the most unlikely family member.
And you had to obtain it from an illegal source, right?
I work in agriculture, and I said, how do you get a plant? And I had to ask around for how do you get a plant? And the plants that you get are not, they don't have that cannabidiol component to it. They all had THC in there. So even the plant that you got that was high in THC, it just didn't have what she needed. So it's very gray on how you do things.
Right. Steve from Manoa comments, I've smoked marijuana daily from age 17 to 50, attended college, graduated, and now I serve as a medical professional. I had 3 intense stomach flus in my life and couldn't keep anything down. I smoked marijuana and the symptoms went away. I could eat and drink. A very common story for you, Dr. Otto?
Well, yes, in terms of the nausea reduction and appetite stimulation, because we don't have any good pharmaceutical substances that stimulate appetite. So that's why HIV and AIDS is one of the indications in Hawaii's program, because it has great benefits in that area as well as in chemotherapy.
Does it actually take the pain away, or does it just stop the patient from sensing pain or whatever they might be feeling in their bodies?
Patients report it differently. What a lot of the reviews are showing right now is that pain relief, chronic pain relief, is one of the strongest indicators for the medical use of marijuana. But in terms of what patients are reporting, some of them will experience drastic reduction in pain that they cannot experience with other narcotics. Also because they don't have the same side effects. They're not groggy, they don't get the constipation and all that kind of stuff. Mm-hmm. But for other patients, it changes the quality of the pain. And it takes away the psychological aspects that make the pain worse. Because when you're in chronic pain, it contributes to all of the other problems in your life in terms of sleeping, anxiety, depression. And marijuana has the ability to treat all of those at the same time. So if you reduce some of those, it also, in addition to directly reducing pain, it also makes that pain seem a little bit more dealable.
Christopher Makiki from Makiki wants to know if the panel can talk about the ancillary services in relation to the legalization of medical marijuana, and how can people get involved in the industry? Carl,
Sure.
do you have any thoughts on that?
I think right now what we're seeing is, of course, we need to see the licensees announced. And a lot of them have thought out business plans from what I've heard. Obviously, otherwise they may not win a license, but they may not necessarily have contracted with people in advance for security, construction, all that. They would have a plan, otherwise they probably wouldn't win. But we're hoping that local businesses can become involved, and once those names are out, there'll be somewhere to turn to. Right now, they don't know. They don't know who's going to win. They don't have the contact information. So that's why we're so excited about the announcement next Friday. And then they can get involved.
Peggy, what kind of knowledge do you have in terms of ancillary services or anything like that?
Well, whatever plans they have. I mean, again, I can't go into any specifics, but certainly you're going to need, I would think, assistance with building and growing and testing. And
does the state actually look at their business plans or their business models, or more of background checks and their finances?
It's a little bit of both. It's actually a little bit of both. There was a vetting process of background checks and finances and stuff, and then the selection panel takes a look at what the plans are and how they're going to do it, and how they're going to address not only the business side, but safety and confidentiality and all of the other. There was a 13-point system to go through.
Is there a face-to-face interview?
There is not.
And there will not be so it's all on paper?
Correct. It was done, and it was also done, it was done electronically, is what I should say, clarification.
And I just wanted to add, that was one of the important things that we try to get into the medical marijuana dispensary bill, the ability for these subcontractors, the ancillary services, to get involved. And in a bill in the legislature right now, we're trying to make sure that some of these ancillary services can actually help more than one licensee. There may be the DOH rules may say that a security service can only help one of the licensees, and that could be problematic on an island with, like Maui. What if there's only one business that does that? Will that prevent a dispensary from opening up? So we just need that flexibility in order to get the dispensaries open to help the patients.
Can you explain there's another, I guess, part of a bill that is in regards to nurses?
Sure. Basically, right now, only physicians have the ability to certify that patients have one of these qualifying conditions. But we know that advanced practice registered nurses have prescription authority and prescription authority for medicines. Right. So, and they often have very close relationships, these types of bona fide relationships with patients. So we see no reason not to get them involved. And the Nursing Association, the AMA, the Hawaii Medical Association, HMA, they're all behind this because they know these nurses, they're qualified, they're interested, and they work with these patients. So that is part of this bill that is in the legislature right now, and we're very confident that that's going to pass.
Dr. Otto, a lot of people still look at Washington, where recreational use is legal. Do you think that Hawaii would be one step away from that?
Well, you know, my perspective is that I'm in this just for our patients. So I'm focusing just on the medical use. And of course, there are some who are looking at this as a possible step towards recreational legalization because we're going to be putting in place all this retail distribution system. So it could certainly lead in that direction. But my focus is just on recognizing the accepted medical use and making sure that our patients get what they need. And I would say that, you know, in Washington's case, they're combining the two so that there's no distinction really between recreation and medical. Patients will go to the recreational stores to buy their medicine and pay the recreational tax on it. So I would hope that for Hawaii that we would always keep the two completely separate. They require different standards for manufacturing, different preparations. So that would be my hope, is that we can keep the two separate no matter what happens with recreational use.
Which is what you're actually seeing in Colorado. You go to a dispensary in Colorado and you will have the recreational and the medical side. So I think Dr. Otto is exactly right. I think that's the way forward, because, you know, as we're advocating for this, we're trying to highlight that it actually has a medical use for patients like MJ. And it's so clearly demonstrated. So I think to mix that later on would defeat the purpose of what we're all trying to do.
And if I could just add to that, my feeling is that part of the reason that the states have not done such a great job with their medical marijuana programs is why there's this push for recreational legalization. Because I think if the programs were really done strictly for medical use, there would be a wide variety of indications that could be added, and a large segment of the population could be helped. But now, you know, states are enacting the laws, and there are delays and there's lawsuits and all this stuff that's making people think, well, maybe we should just go straight to recreational legalization. So that is one of the dangers here.
Jari, you know, since you've been open about your daughter's struggles and her condition with epilepsy, how many people have you met who still want to remain behind the scenes, especially with children who are using medical marijuana?
Quite a bit. We have mom events at our house that we get together and we learn how to make different types of products and oils, whether it's oils or alcohol extracted oils or botanical oils, depending what the parents want. But there's a lot of parents that are interested. There's a lot of family members that are interested. But I would say they're underground right now, and I think it's going to take time for them to come forward.
Interesting. That just opened up a whole new community of people to you when you started using this for your daughter?
You know, we were on our own when we got our card. We didn't know what to do, where to get the plant, what to do. I mean, I have an agriculture background. I didn't know how to grow the plant. I didn't know there was a light differential in terms of flowering and vegetation. And I found this community online that just picked me up and pushed us on our way and said, this is what you need to do. And it's that community that came forward for her. And I mean, stories that you would not believe about people just finding things for her benefit without wanting to be recognized or anything. And I really think it's this community, the medical marijuana community here in Hawaii, that knows that she could benefit from it, and they knew that she could be the spokesperson for them. And that's what she doesn't have a voice, but that's what her charge is in life, I believe.
For your neighbors or anyone in your community who knows that you're growing plants now, have you ever received any negative reaction?
Never. We've been very open. Our representative Beth Fukumoto, our Senator Donovan Dela Cruz has notified our community that the dispensary bill is going to help a child in the community. The community knows that this bill exists. I mean, the law exists, and they know that it has medical value, and it's something that they've never fought they've never fought us on.
Yeah, Marty from Wailoa wants to know who's going to be monitoring the patients on marijuana. And so, Peggy, can you describe a little bit more in terms of monitoring the patients and monitoring physicians at the same time?
As far as monitoring patients, that would be the physician-patient relationship, and again, I'm only on the dispensary side, and it's two
Right.
different. Although it says medical marijuana, but as far as the registry, then they, pardon me, they, as Dr. Otto said before, that they have an annual re-registration. They get a recertification, and then they register on an annual basis.
Well, and one thing that we do have available is the registration process right now requires that the patient have an email account. So the Department of Health has the list of all the patients, all of their email addresses, which could be a huge resource if there was a way to confidentially access that and survey the patients and find out what are the preparations that work for certain conditions. What would they like to see in the dispensary for their medical needs? I think there's some potential there.
Jean from Hilo wants to know about people on a fixed income and how can they afford medical marijuana. Jari, can you explain a little bit more how you managed to pull your resources for these plants and to make this?
Right. It's not easy. She used to utilize a non-FDA approved drug, which was $700 a month. And so this is cheaper than that, but still it takes a lot out of your bank account every month. So when we had a dying child, so we did what we had to do. But there's companies out there that are going to put together compassionate care programs, and they're going to have sliding scales for those that don't have financial resources to purchase from dispensaries. So I think that's going to be helpful. And I think the dispensaries are mindful of the fact that we live in Hawaii. Many people have 2 jobs, and the cost factor. So it's something that the business owners that I've talked to who are applying for dispensaries, they understand that people are on fixed incomes, and I'm hoping that they're going to come up with good plans to address that.
And I think this also speaks to that this is part of a broader movement. The more legitimate this becomes, the more we lessen the stigma, the greater chance there is of rescheduling it, the greater chance there is of getting it involved in Medicaid programs and getting help for patients to buy this medicine just like any other medicine. So, and if it comes to that, we'd be willing to look at legislation to regulate the prices in order for it to be affordable, because we can't have marijuana that costs much more in the dispensaries than people who make it. That would just be absurd.
And do you think there would be a time when actually insurance companies would cover it?
Sure. That's in the future. That's unavoidable.
Peggy, here's a question from one of our viewers, from Zoe from the North Shore. Once the dispensaries are up and running, would they consider accepting plants from local growers to accept the economy? Or does it have to be grown at where the dispensary is?
Definitely, that has to be addressed to the dispensary operators as far as how they're going to do and who they're going to do and what product that they're going to do, because as we're hearing, there's all kinds of different products that they'll be making and different, different potencies and different uses.
The state is not involved in that part.
No, we're not. No. Now we will be doing tracking, so because again, going back to ensuring all the safeties, we want to be sure that we don't have diversion of product, that this is for medicinal purposes, it's proper purposes. So we will be looking at that because that addresses the public safety issue, but no, we wouldn't be. That would be addressed to the individual operator.
Carl, what are your contacts in the federal government doing about this issue? It's police are just looking the other way at this time in terms of medical marijuana or marijuana in general. Well, it's an interesting predicament that the states are in right now.
Sure. I mean, in terms of my contacts at the federal level, I would first of all highlight that our state senators, our U.S. senators, Senator Hirono and Senator Schatz, are supportive of medical marijuana. Just a few days ago, or I think yesterday, Senator Schatz on the Senate Appropriations Committee voted for an amendment to the budget saying that Veterans Administration doctors should be able to certify their patients and recommend medical marijuana, which currently they don't do. A lot of vets suffer from PTSD, and that is something that we added by statute as one of the qualifying conditions, but a lot of the VA doctors are not willing to get involved because of the law.
Yes.
But now you have that amendment having passed. So we have federal legislators supportive, and in terms of the federal government's law enforcement arm, you have the DEA and that DOJ basically they're looking the other way because they're seeing that medical marijuana is the future. It is helping patients. It's not a priority for them to go after people who are doing that. That's what they're saying, and we'll hold them to that. And if I could just go back to the whole transportation issue of patients going between islands or lab samples, you know, we think that that is not a priority for the federal government. So we want to push the envelope as much as possible to allow, first of all, lab samples to go between neighbor islands. And if there's no lab on one island, we want to make sure that something can be tested on another island and you can bring that lab sample. But we also want to let patients travel with their medicine, like with any other medicine. And we realize that may not be the time right now, but we're seeing that in other states. We're seeing patients flying within the state of Oregon. We're seeing patients taking ferries in the state of Washington with their medical marijuana. So I think that's coming for Hawaii very soon as well.
Viran from Kauai says they have a chronic sleep disorder and currently using Ambien, which is a sleep aid. Could medical marijuana be a more natural solution, Dr. Otto?
Well, I think there's big potential in that area, and I believe that was one of the indications that was tried to be added this year, insomnia. But it really depends on the cannabinoid that's being used. Folks who will use more high THC material for pain relief will find as the effects are wearing off that it does make them sleepy. But there's also the degradation product of THC, cannabinol, which is also very good for inducing sleep. And that's something that we need to do more research on. I just wanted to make a comment about what's going on at the congressional level, if I could. You know, we're talking about this policy right now that's saying that the DEA and Department of Justice are going to turn their eyes and look the other way. But we have to keep in mind that that's just a policy, and that the laws, the regulation, the federal regulation, still says it's in Schedule 1. And you have Congress trying to defund the DEA as a way to try and get them to stop bothering state programs, when we know that the DEA does not have the authority to declare illegitimate a standard of medical care that's authorized under state law. So this is something that could be addressed at the state level as well to try and clarify some of this discrepancy.
Why do you think marijuana in general has been so criminalized when it's been around for a long, long time?
Well, I don't know if people watched the former chief of staff of President Nixon talking about why they specifically criminalized marijuana and heroin. It was to go after their political enemies. That's on the record. So that's one of the aspects that we're really also involved with. It's the social justice aspect. We want to lessen the incarceration of individuals for personal drug use, but I mean, especially for people who use it for medical purposes. And the side effect of criminalizing marijuana across the board is that patients are also criminalized. So the reasons why it happened, ignorance, malevolence, all kinds of reasons across time, like why that happened. And I think people are waking up to that. They're seeing that it really targets certain communities, and it's created this mass prison industrial complex that we're trying to deal with. Even in our state, we're shipping people off island every year, and they're put in prison in Arizona for personal drug use, and that just seems wrong.
Peggy, you mentioned earlier that you fell into this position, if you will, because you wanted to help people.
Yeah, like I said, being a caregiver myself, watching somebody in pain, and just becoming aware of other situations when the position was open, it was just an opportunity that I thought, this is what I want to do. This is a passion. Everybody here, you can see, is very passionate about this. And so this is a nice opportunity also, because, you know, the state often is perceived as the state, you know, but we're moving and we're making history here. And again, we're going to do it so that people are protected, safe. We're going to have some bumps in the road for sure. I mean, and we won't always agree as we make our way through this. But having said that, we're already in a better place, and we're going to continue to be in a better place. And again, with the priority for us of patient safety, product safety, and the public safety. It's all this balancing.
Jari, once these dispensaries are up and running, where do you see yourself going? Do you think you would still continue to grow your own plants, or do you think you would go to the dispensaries? How do you think your life would change once these become normal?
Right, I'm looking forward to it. I've been debating with that topic myself. I would like to keep a few plants at home, but for us, it's always been about access and having lab quality medicine, because with epilepsy and our daughter, her brain is constantly firing. And so what we found is you really need to be consistent in that medication. It has to be the same dose every day at the same time. And when that changes and the fluctuation in your growing changes as well, that's when they start coming through, the breakthrough seizures come through. So for us, it's always been about access, affordability, and lab tested materials. So we're willing to put up those dollars to go to the dispensary, because we have another son as well. I mean, we have a older son, and he's getting older. We want to spend time with him, and so our time is very valuable. And so we're willing to pay the price for the dispensary product in exchange for getting part of our life back, and I think it's going to be well worth it.
Well, Jari, I wanted to thank you, your family, and all of you tonight for speaking with us on Insights. We had a lot of questions, so certainly a lot more to be discussed in the future. Thank you.
Thank you.
Well, Insights will be on hiatus for 3 weeks as we prepare for our big move to our new home across town on Nimitz Highway on Sand Island Access Road. We plan to be back on May 19th with a show that explores the controversy surrounding marine mammals in captivity in Hawaii. That's next time on Insights on PBS Hawaii. I'm Mahialani Richardson. Ahui ho.